Good afternoon, and welcome to our 2017 Healthcare Reform webinar for Calo Health. My name is Justin Brogdon, and I am the sales manager here at Calo Health. And what we're going to do this afternoon is just really try to clear up some confusion and show you how to find the best value, including some inexpensive options with our faith-based sharing plans. So let's get started. We won't spend too much time on this webinar, but I do want to cover some of the basics. As most of you know, the open enrollment period began on November 1st, so we are in the thick of it now, and open enrollment will continue until January 31st. So some key dates that we want to be aware of, looking at this graph on this one slide that we're looking at here. For a January 1 effective date, we want to make sure that you have your coverage submitted by the 15th of December. So the 15th of each month is the cutoff date to get a first effective date of the following month. So as you can see, if you don't get your enrollment completed until December 16th, your coverage is going to start February 1st. So just keep that in mind when you are planning out, your whole process, your strategy for getting coverage for 2017. All right, so let's get to the nitty-gritty. We've got some positive changes that have come as a result of the Affordable Care Act, and as the years wear on, we are seeing definitely some negative sides to the Affordable Care Act as well. Definitely so this year in Colorado. So let's look at them. The best things about Obamacare, as we all know, is that no one can be turned down. You can't have any exclusions on any type of pre-existing health issues that you may have, and it's giving access to millions of people who didn't have access to health care prior to that. And the not so great, obviously, for 2017, we are looking at some major rate increases. People seem to be in shock right now from the clients that I'm talking to at how much their premiums have gone up since last year and how much less they're getting out of their plan. Another big change for 2017 in Colorado is that there are no longer any PPO networks available. So all of the networks on the plans offered are HMOs or EPOs. I know many of you are familiar with an HMO, which does require that you establish your primary care physician and receive all of your care at an in-network facility, and you have to get referrals from your primary for any specialty care. If you are outside of your coverage area, unless it's a life-threatening emergency, you do not have coverage with an HMO. So very similar to that, an EPO, the only difference with most EPOs is that you do not have to get referrals from your primary to see a specialist. So you still, you will have to establish your primary care physician, and you do not have coverage outside of your network, but you are able to see specialists without getting a referral. And obviously, as many of you have seen, fewer plan choices. There are a lot of areas in Colorado where there's only one insurance company available, so it's made for a lack of competition, which ultimately competition drives the cost down. So that's something to do with what we're seeing with the overall rates. I want to just kind of briefly cover the metallic tier levels of the plan. So again, we've got our bronze, silver, gold, and platinum level plans. And there's also a catastrophic plan that is not included in this metallic tiers, but these plans are available for people that are 30 and under, and they're catastrophic plans. So they've got the highest out-of-pocket deductibles and out-of-pocket maximums that you can have, but do include a few doctor's appointments a year. So they're good for folks who are for the young 20s crowd who's in college and may not have a whole lot of income, where they may not qualify for a subsidy. Most of the plans that we're going to see, most of our clients getting enrolled in, has a lot to do with where their price point is, are the bronze and silver plans. So we'll talk about this in just a minute, but I do want to touch on this for if you are eligible for a tax credit or a subsidy, and then you're also eligible for cost-sharing assistance, which is an additional benefit offered to those who are 250% of the federal poverty level and below. That cost-sharing assistance drives down your liability within the plan, and that pertains to just silver level plans. So keep that in mind. All right, so for a plan to be ACA compliant, it must include the 10 essential health benefits. I'm not going to go through all these, but the main ones we want to look at here. The biggest one is that it covers all of your preventive and wellness health, 100% not subject to the deductible or any co-insurance. So that would be all of, for men, it'd be their annual checkups, any kind of PSA testing they have depending on their age. And for women, that would be your annual checkup, pap smears, mammograms, things of that nature. All of your children's well baby visits, all this fall under preventive as well. One important note to make about preventive care is that when you go to get your checkup, it is counted as your preventive visit, and you should not have to pay anything. The exception is if they were to find some abnormality on any type of testing that they did and they wanted to do some further testing, at that point it would become diagnostic and not preventive, and that would be subject to the deductible and co-insurance. All right, so also maternity coverage and newborn care is included on all plans regardless of whether you are trying to get pregnant or not. So that's a question we get asked about a whole lot, but maternity coverage, all of these benefits that you see here must be included on every single plan, regardless of whether that's a need that you have or not. So that has a lot to do with where the prices are on the plans as well. So how are the premiums calculated? Well, they're calculated no longer on based on risk or health history. So now they can only be calculated on three things: your age, where you live, and that can be all the way down to the county, and whether or not you use tobacco. So you can no longer be denied coverage for any type of pre-existing condition or charged a higher premium as a result of a pre-existing condition. As I mentioned before, let's take a quick look at the advanced premium tax credits and cost sharing. So this is a benefit offered to those who fall between 400% of the federal poverty level, and in Colorado, that'd be 138% is the bottom threshold, which is the threshold for Medicaid, where you would have free coverage. And as you can see, at 400% for an individual, that's $47,000 roughly, and for a family of four, that'd be right around $97,000. As I mentioned, if you're at 250% or below the federal poverty level, you're also eligible for cost sharing assistance. And as I mentioned, I like to give the analogy, the premium assistance deals with the monthly expense of carrying the health insurance. So what it's going to cost you each month to have that card in your pocket. The cost sharing assistance relates to the liability within the plan. So that would lower your deductibles, your copays, your out-of-pocket maximums, all of those types of things. So more often than not, if you are eligible for cost sharing assistance, you definitely want to take advantage of it. And in order to do that, you must enroll in a silver level plan. All right, so what are your options? Well, this year things are tough. As I mentioned, there are no PPO plans. And I want to just briefly go through the carriers and give you some insight from my perspective working with my clients and what I'm seeing. Kaiser overall does have the lowest rates. They are an HMO. They do require, where available, that you do use their Kaiser clinics for all of your primary care, and then they do refer outside of their clinics for some specialty care. But because of how they're structured, they year in, year out seem to be one of the most competitively priced plans. And if you're used to that type of coverage with Kaiser, most of my clients I find love the coverage. It does take a little getting used to, though, if you're not used to how an HMO works. All right, next in line would be Blue Cross's HMO. They're not offering their PPO, but in many counties, their HMO option is the only option available. So one of those plans with that network. And, Blue Cross has a great footprint in Colorado and is a great option. They're priced a little higher than what I would like to see them. In the past years, they've been very competitive with their pricing, especially with their PPO plans. And this year, they seem to have really stepped their pricing up a little bit. There is a new carrier this year in Colorado, Bright Health. Don't have a whole lot to report on them because they don't have much of a track record, but I will say that they do have an EPO network, which does allow you to see specialists without having to get a referral. It doesn't seem to be a really robust provider network as it stands now, but they do seem to be really competitive in some counties, so keep them in mind as well. Cigna, they are just offered in just a few counties in Colorado, but there is some confusion that I want to clear up. Cigna actually has two EPO networks. They have their Connect EPO network, which is their most popular one that they're offering now. And then they have their Vantage network, which is also an EPO. This is where I said most EPOs are this way because Cigna's Connect EPO actually functions 100% like an HMO. So it does require, for any Cigna Connect plans, you will have to get a referral from your primary care physician to see specialty care. Their Vantage EPO network is actually a true EPO where you do not have to get referrals for specialty care. And the last carrier that I want to point out, it's not a carrier that's in a lot of areas in Colorado, but Elevate by Denver Health, their HMO, is a good option in some areas. They seem to be pretty competitive in the markets that they are in. And as I mentioned, the pricing overall in Colorado has just really gone through the roof, and we're seeing a lot of our clients who are looking for an alternative and trying to figure out a way to manage their monthly expenses to protect their health and their wealth. And many of them have gained a lot of interest in faith-based coverage. So we have partnered with a few of the Christian health shares, and they have varying degrees of what they require you to have to attest to in terms of your faith. But the things that are very similar with all of them, I've pointed out here, and I want to just briefly cover them. So it's not health insurance. It is a health share ministry. It will give you an exemption from the ACA penalties. And it's definitely not a good fit for everyone. So for anyone that has ongoing medical needs currently or is being treated for anything, it's probably not a good fit for you. It is a great fit for anyone who's pretty healthy and is really looking for catastrophic coverage and to know that they're going to be covered in a worst case scenario but don't have any ongoing healthcare needs to speak of. So they do require underwriting. So there is a health history review, and there are pre-existing exclusions for pre-existing conditions. No tobacco use. So if you use tobacco at all, you would be ineligible for these types of products, except for one that we are still ironing out the details on. And the most impressive thing about all of them is that their premiums are much lower, half, sometimes a third of what an ACA compliant comparable option would look like. So I do recommend that if you have any interest in these plans, that you do schedule an appointment with one of our personal benefits consultants where we can walk you through the coverage and really kind of analyze your situation and help you find, get a better idea of whether that might be a good fit for you and your family. So if you do not carry health insurance that's ACA compliant or a plan that offers you an exemption, there is a penalty, of course. It is $695 per uninsured adult in a household, and that would be capped at $2,085 versus 2.5% of your household income above and beyond the filing threshold. So be aware of that. I know there is some confusion sometimes about whether it's just a flat fee or it is based on a percentage of your income. So it's whichever is greater. So it's the flat fee or 2.5% of your household income. If your 2.5% of your household income is more than $2,085, it's going to be whatever that is. Okay, well, we're getting to the end of this, and these are just some tips I want to encourage everybody. I do this with my clients every year. You want to make sure that you are proactive. These systems seem to get bogged down when we get close to deadlines because there's more people on them, and the servers just are not built to withstand the type of volume that they get on there. And that is where we see that the biggest issues tend to arise. So be proactive. Go ahead and get it out of the way. Schedule an appointment with us today to help you with your health insurance needs. Connect for Health Colorado does require that you submit a Medicaid determination prior to applying for coverage if you're trying to get any assistance. So if you're looking to get an advanced premium tax credit and or cost sharing, you will have to go through their PEAK application. It is embedded in their website, and we'd be more than happy to assist you with that whole process as well. I would expect delays in processing. We see this every year, and this is with every carrier. So we encourage your patience. We do all we can with our clients to stay in good contact and keeping them up to date on the status of their pending application or their pending coverage, pending its start date of January 1. As you can see, feel free to call us at Calo Health at 866-749-2045 to request a free consultation. You know, my next thing I want to just say is the reason that you should do that is that we found, especially as confusing as the Affordable Care Act has made purchasing health insurance and understanding what you're getting for your money, it really helps to have an advocate. And that's what's important to me with my clients, and it's certainly important to our entire team. We want to be here to help you avoid costly and really, and not just money, but also in time, mistakes that can easily happen. When you work with a navigator, they are not a licensed health insurance agent, and they don't necessarily have a really good grasp on the landscape of the industry. That's what we do, and we do it all year round, and it's not just before you become one of our clients. Our commitment is to make it easy for you, and that's before and after you become one of our clients. So we're always here to help answer any questions, to help you deal with any types of claim issues that you might have, and we want to be your we want to be your advocate and the person that you reach to whenever you have questions with your health insurance, but certainly whenever you have questions about any of your health-related needs. And that extends beyond your health insurance to your retirement planning and to any life insurance needs that you may have, as well as any of our other ancillary products like critical illness and accident coverage, things like that that really have value and are absolutely worth the money to help you protect your health and wealth. All right, just a quick recap. So open enrollment began on the 1st of November, and it's going to go through January 31st. ACA compliant plans are extremely expensive this year in Colorado. It's hard to wrap your head around a little bit when you're looking at these rates for what you get, but the good thing is that there are no pre-existing exclusions on any of these plans, and just be aware that the provider networks are smaller with HMOs and that there are no PPOs. And for those who really see the value in HSA qualified plans, we still firmly believe that HSAs are still the way to go. Consumer-driven healthcare is the best practice to keep your monthly expenses at a minimum and also take as much of a tax advantage as you can by being able to utilize that health savings account. So at this point, I would like to invite you all to, you can give us a ring at 866-749-2045 and schedule an appointment with one of our personal benefits consultants, or you can certainly email us at saleshelp@calohealth.com. And we look forward to hearing from you, and we are here to make this process as easy as possible for you. So please don't hesitate to reach out. Thanks, and you guys have a great day.